Well, this month is Men's Health Month, and Dr. Matthew Kincade of the ETMC Urology Institute is here to talk about that. June, Men's Health Month, what's that mean to you and me?
Well, for me, not so much. I don't know exactly how old you are, but
old enough.
Guys who are 50 years old or less, basically we need to pay better attention to ourselves and our prostate health. June being Men's Health Month, ETMC is hosting a prostate cancer screening free to the community. There's lots of different sites around East Texas where we can go, and we'll draw your blood, send it off for PSA testing, and we'll let you know the results. And if there's something abnormal about it, we'll tell you exactly what you can do about that.
Okay, and tell us a little bit about the PSA testing and why we need to screen for that on a pretty regular basis.
Definitely. PSA stands for prostate-specific antigen. It's a chemical that's made by a normal prostate, but it's made in higher levels in cancerous prostates. So what we do is we check levels and we compare them to kind of age-accepted norms. And if it's elevated, then we talk about what we need to do in terms of trying to diagnose a possible prostate cancer. And that also is paired with nobody's favorite test, the digital rectal exam. But we're not offering that. We're just doing the blood test. So.
Okay. Good. And if someone does show some elevation in that testing, then what kind of things would you do?
Well, the next step of that is a prostate biopsy. And again, that's a procedure. It takes about 15 minutes. We do it in the office. And we take about a dozen or so cores of the prostate. We send that off to the pathologist. And they're able to look at it under a microscope and see whether there is cancer, whether there's no cancer, or whether there's kind of an in-between diagnosis that we just need to keep a very close eye on.
And you mentioned specific people and age-related testing here. So you talk about people over 50 or?
Typically, usually when a patient is 50 years old, or if they're African American, or if they have a family history of prostate cancer, we tend to recommend them to come in 5 to 10 years early, so about 40 to 45 years. Usually we stop screening at about age 80, but that's kind of a discussion we like to have with our patients because they're very healthy 85-year-olds, and they're not so healthy 70 or 75-year-olds.
With the economy the way it is, I know there's concern about people cutting back on their health care to some degree. Have you noticed any of that with people coming in for screenings?
Yeah, we have, and that's one of the great things about this free screening is, you just have to get to the clinic and we'll take care of the rest, and we make it pretty much a foolproof way for guys who just typically don't like to do a whole lot to go to the doctor and get checked out if they feel fine. Just have the ability to get that PSA screening, and then if we need to do something else, then we can talk about that later on. But this is just a great way for guys to pay attention to themselves.
You recommend this how often?
Typically every year. Every year a PSA and the rectal exam, okay. And then if that's great, then we just watch you for a year, and if not, then we can intervene.
Outstanding. So you need to take advantage of this. It's a great service and a good opportunity.
It's all through the month of June. And I believe the number's on the screen there. Just give us a call. Don't wait too long, though, because June's about halfway done. So we really want to get everybody that we can to make sure that we're all doing okay.
Outstanding. Now, if you need to find out more about that, you can go to our website, cbs19.tv, and we'll have all the information there and direct you to where you can go for those screenings. Dr. Kincade, thank you very much.
Thank you very much. I appreciate y'all having me on.
Happy Men's Health Month to you, sir.
Thank you. Same to you.
All right, thank you.